Listen to this because it matters a lot when it comes to your health, whereby tuberculosis, that is TB, remains one of the top infectious causes of death globally. Well, Kenya has demonstrated worthy progress in achieving a 32% decline in TB occurrence and a 42% reduction in deaths between 2015 and 2020. TB remains a major challenge in the country. To deal with this, the National Tuberculosis, Leprosy and Lung Disease Unit under the Ministry of Health has launched the 2023-2024 to 2027-2028 National Strategic Plan for tuberculosis, leprosy and lung health, a strategic plan that sets out the roadmap for the realization of a TB-free world, more so here in Kenya.
The unique healthcare needs of children affected by this infectious disease. The adoption of the simplified diagnostic algorithm will ensure diagnosing TB in children is made easier, contributing to increased early and more accurate detection. This commendable initiative underscores Kenya's commitment to advancing healthcare and serves as a beacon of progress for the region in the collective endeavor to combat childhood tuberculosis. We continue to acknowledge the significant efforts put in by the government of Kenya in prioritizing the health agenda within the social pillar. The significant strides toward achieving universal health coverage, emphasizing a preventive and promotive approach, is pivotal for delivering holistic, people-centered TB care, particularly for people with TB who face socioeconomic vulnerabilities, as it will ensure access to quality, timely, affordable, and safe healthcare services. Hongera. As WHO, we stand ready to continue supporting the adoption of global guidance and initiatives, providing technical assistance, building capacity, and facilitating knowledge sharing to ensure that global best practices inform Kenya's efforts in combating tuberculosis. Thank you for your attention and extend my best wishes to Kenya for great success in the implementation of these milestones.
Address TB in learning institutions, letting the Ministry of Transport handle TB that is within their jurisdiction, the Ministry of Agriculture to ensure there's sufficient food to combat malnutrition, Ministry of Interior to manage TB transmission within prisons, and the Ministry of Housing to ensure that we have policies that are in line with TB prevention, including proper lighting. The Ministry of Foreign Affairs to ensure that they safeguard TB-related human rights for migrating Kenyans. And the Ministry of Sports to leverage on sports platform for TB awareness. And the Ministry of Information to disseminate TB-related information to the public, similar to how they did it during COVID.
In Paris. I'm also very excited about the way this NSP was developed. Really just, looking at the data, engaging all the stakeholders, and using the most relevant science to make sure we have something that will get us to where we need to be. Finding at minimum 90% of the cases up from 68%, and reducing mortality further to make sure that we do not have deaths from a curable disease like TB. As I said, we've reduced by close to 60%, but we still had 22,000 deaths, actually many more than HIV did.